Hi, my name is Francis and I have severe hemophilia. If you're watching this video, it's because you or a loved one has a bleeding disorder. Maybe it's hemophilia, like me, maybe it's von Willebrand disease, a rare factor deficiency, or a platelet dysfunction. Either way, if you're watching this video, it's because you're seriously considering learning how to self-infuse. And I get that. Right now, chances are your parents are still responsible for giving you your medicine. And I'm sure they do a wonderful job. But you want to have more control. You want to be more independent and might even want to manage your condition better. Because it's true, when you have a bleeding disorder, everything becomes easier when you're able to self-infuse. And you'll see, it's easier than it looks. First of all, there's no right age to start. It's together with your family and your treatment team that you'll decide when's the right time to start self-infusing. The most important thing is that you feel comfortable. There are still 3 big questions you can ask yourself to make sure you're ready to start learning about self-infusion. First of all, are you able to describe your bleeding disorder? Secondly, are you able to identify the symptoms of a bleed? And finally, are you able to prepare your factor in a safe manner? Before starting self-infusion, there's a little bit of preparation. First of all, you need to wash your hands with soap and you need to dry them with a clean towel. Secondly, you need to choose a work surface that is clean and unobstructed in a room that is quiet, comfortable, and well lit. Finally, follow the instruction to prepare your factor. The most practical and accessible area are the elbow crease and on top of the end, ideally on the opposite side of your dominant hand. But my advice is to choose the veins that you're already using. Chances are they're already less sensitive than when you were young, and that's the perfect place to start. The ideal is to have 2 or 3 veins that are easy to poke so you can use them in turn and spare them. But there are ways you can prepare your veins. First of all, avoid self-infusing as soon as you wake up. Then, avoid doing it in a cold room. For visible and firm veins, remember to drink as much water as possible. You can also do a little bit of exercise. You can do a couple of push-ups or simply clench your fists a couple of seconds. Finally, a good trick is to take a shower a couple of minutes before self-infusing. First thing first, we place the tourniquet a few centimeters above the vein we wish to use. There's no need to tighten it right away. Then we disinfect the skin with alcohol and let it dry. It's very important to clean the area around the vein to prevent germs from entering during the infusion. Just before moving on to the next step, the tourniquet can be tightened just a little bit more to ensure the veins are visible and fully dilated. It's time to grab the needle that is known as a butterfly because it has 2 wings. Ideally, you take the wings between your thumb and your index finger to have the best possible control. The needle's course can be compared to the landing of an airplane. A more vertical angle when puncturing, but then gradually horizontal to properly install the needle in the vein. This trajectory allows the needle to be well installed in the vein without piercing it. As the needle enters the vein, you may feel a slight resistance and see blood appear in the tube of the butterfly. This is a good sign. It means we're now in the vein. Then we fold the wings of the butterfly so that they rest on the skin. If the needle seems stable, it means that it's well in place. On the other hand, if it seems a tad unstable, we can always continue to push it slightly, 1 to 2 millimeters deeper. Check that the needle is correctly positioned by gently pulling the plunger out of the syringe. If blood rises up in the tube, we can remove the tourniquet and start injecting factor. We can start to infuse the product by slowly pushing down the plunger of the syringe with even pressure. The factor concentrate should be administered at the rate that is described in the instructions that came with your medication. Keep an eye on the vein to check for swelling at the injection site. Swelling occurs when the needle has grazed the vein without piercing it. This happens when the angle of the needle is not vertical enough. If instead of swelling, an ecchymosis or a bruise appears, the needle has unfortunately pierced the vein. In both cases, don't panic. Slowly withdraw the needle and apply pressure for 5 minutes before trying it again on another vein. Even the pros make mistakes. If all went well and the full amount of product has been administered, it's time to remove the needle. Grab the butterfly between your index finger and your thumb and remove the needle in a gentle but constant motion. Finally, we apply pressure on the vein with a gauze or dry cotton ball for 3 to 5 minutes. And just like that, we completed our first self-infusion. So there you go. These were the basics of self-infusion. I remember like it was yesterday, the first time I was able to self-infuse. A mix of happiness and relief. Because deep down, I knew I just had gone through one of the biggest stages of my life with a bleeding disorder. And congratulations, because you're about to do the same. If you have any questions, don't hesitate to reach out to your treatment team.